phone call.
Ghostbuster.
Anyway, giant mushroom. Mushroom. Seriously?
That's
marshmallow.
That was back in your college days when you would holler that.
See?
You're listening to the Help Me with HIPAA podcast, where HIPAA and humor collide to make learning fun. Your delightful hosts are Donna Grindle and David Sims. Relax, HIPAA help is on the way.
This is Amy Moykich from Atlanta Gynecology and Obstetrics in Lilburn, Georgia, and you are listening to the Help Me with HIPAA podcast.
Thank you for that intro. I'm David Sims of HIPAA for MSPs and Security First IT, and joining me is Donna Grindle of Carden.
How you doing?
Good morning. So today, we're going to talk about the signs.
I know. Signs. This is episode 222. And I was trying to figure out what to do with it. You know, I went back to my youth and watching Room 222 for those of you that are old enough and remember, you know, such a cool show. Karen Valentine, the young teacher, couldn't come up with some way to tie that in. So then and I searched for 222 and all these people call it a sign and it's, you know, that freaked me out. So I'm like, hey, it's signs.
Yeah.
3 times 2. It's 6 signs. 3 times 2. There's 6 signs.
Yep. So we're going to talk about these 6 signs that your HIPAA program is maturing.
Yeah, that you should be looking for this. This is well, there we went.
Off the rails already.
I know. Well, you know, the brain gets going so much faster and it just leaves everybody else behind. So this is when you know that you're running on all cylinders with your HIPAA program.
Cool. So, so we're going to tell you how to look at the signs and know that it's getting mature. And, you know, other than things like, you know, puberty and voice cracking and all that, you'll be able to know that that's your sign of maturity.
There you go. All right.
So before we dive into all that, do you have anything coming up other than the HIPAA boot camp?
Well, when this airs next week, I'll be in Memphis talking to the Ambulatory Surgical Center Association in Tasca, Tennessee state meeting, talking about cybersecurity and ransomware and what you should do to prepare. Exciting stuff. But we've actually started booking some dates in 2020. I'm just struggling fitting in stuff, you know. It's tough to decide what to do. Yeah. You know?
We have a cybersecurity summit we're doing in our area. October 24th. So if you're in the Charlotte area, it's being presented by the Lancaster Chamber of Commerce. And we're putting it all together and getting speakers in, and it's just going to be a half day. This is going to be the first one. So we plan on forcing them to make it an annual event. They don't know that yet. So we're going to do half a day this year, and then I plan to hopefully make it a full day event, you know, maybe every October during Cybersecurity Awareness Month. To do a whole cybersecurity thing for business peoples in the area.
Yeah. So we got stuff going on everywhere.
Mm-hmm.
Yeah. So we've got, after the break, I've got some shout outs to do.
Okay. So the HIPAA Boot Camp, the HIPAAbootcamp.com, cart's open, ready to roll. Early bird specials are out there. We've got people signing up. So better get in.
Things. If you want information and somebody filled out the do the boot camp listener survey, but you didn't give us your, because it's anonymous, you can choose to give us your email. You didn't. And I was looking at that the other day and I'm like, I don't know how to tell you, but boot camp's there. Boot camp.
Yeah. Call me and let me know, but I'm not giving you my number.
Yeah.
Maybe it's a test. Maybe they're trying to see if you're like scraping their email address somehow.
Yeah, that's always the thing where you get the digits, but they're not the real digits. Yeah.
Yeah. It's like when the girl gives you the wrong number and you're like, I know she had to
Yeah,
transpose the last couple numbers. Let me just call them all.
Take a hint.
Every time I dial 911, I don't get her. I don't understand.
Yeah, different person. Off we go. On to another.
Off the rails. All right. So we're going to let you do the shout outs in just a minute, right? After the break.
Yep.
And then we'll jump into some mature stuff, which we never do. All right. So after the break, here we go.
Cybercrime is a multi-billion-dollar industry and growing. How confident are you that your computer network can withstand a cyber attack? Can you afford to take the chance that what you have today will protect you? Call us and find out if the cybersecurity in your business is something you should be concerned about, or if you can rest easy knowing your business is protected. Visit us online at securityfirstit.com. That's securityfirstit.com and schedule a time to talk.
Did you know that 83% of healthcare organizations report a strong negative impact to their bottom line after a data breach? So many doctors think that they're HIPAA compliant and have nothing to worry about. Many of those organizations thought the same thing before it happened to them. Call Cardin today at 678-292-5001 so they can assess your practice and help ensure you are protected and prepared. Visit cardinhq.com to learn more.
Now we've got some shout outs to do. That goes to several listeners who've sent stuff in and I just haven't been able to answer or have had conversations and not mentioned it because I like to keep things from David. But Patrick Smith sent in, clearly he's an Indiana Hoosier based on his email. Where can I access a list of questions to help with a walkthrough at a shared office space? We don't just hand those out, but our partners at Comply Assistant, so you can go to complyassistant.com, and on their resources page, they have some free tools, and that includes the ability to download some templates, and one of those is a facility security walkthrough checklist. And that would give you a template to start with, and then, of course, you need to customize that so that it meets your facility requirements, but that should give you a place to start anyway. That's all I got on that. Then we've got a really cool one, and this goes back to June, and I was out of town having these email conversations, so it didn't make it into a recording, but this is a shout out to Kim Garner. How about that? Kim Garner sent in an email that said, you guys rock. And I do love it that she said, it's the best quote ever. I have to admit that when I realized I'd replace my Get Hype playlist I listened to on my way to work with a podcast about HIPAA, I wondered when I'd become old and lame. I listened, I learned, I laughed. Thanks to you, there are no cool points lost. I still got it. And that's the best quote ever. Love it. You have to put that everywhere on the website and stuff. Yeah. But she asked to use the slogan, HIPAA's not about compliance, it's about patient care, in a flag contest that they were doing at the facility where she works. And she's talking about how everybody thinks HIPAA feels like a bureaucratic hassle. And she thinks that our slogan was great and it would help the providers and clinical support staff know that, you know, it is about patient care, and especially because she works at a Veterans Affairs Medical Center. So we really appreciate the work you do, and we know how important it is. And we were thrilled that you wanted to use HIPAA is not about compliance, it's about patient care in a really cool flag. And I'll throw a picture of it out on the website. Show notes. Jeez, Pete. It's a bad day. Clearly a bad day. And then the last but not least, our friend George in Washington, Oregon, which is freaky for me anyway, just saying, sent us something cool. I have not had a chance to do it, but he is absolutely right. It's something I would be interested in. recipe for the Patch Tuesday cocktail. And I'm like, he found it on TV Windows episode. I don't know. He told me about it. I will be trying it. It involves whiskey, lemon juice. I love that it 2 dash of bitters because Patch Tuesday is a little sour and a little bitter. Honey to add a little hope. So it's really funny. And it serves two because no one should drink alone on Patch Tuesday. So, but I'm pumped. And of course, Donna, thanks for keeping David straight, which, so shout out to George. And thanks for that. We've got a couple more that I got to get in, but those are the ones I can get in for today.
Yeah. George, her keeping me straight is an illusion. Just to let you know.
It's not for real. Yes.
Yep.
All right. So now that I've fumbled my way through that, let's get down to some maturity.
Oh, yes. Maturity. So we talked about maturity one time before in a past episode. And
well, that was security maturity.
Yeah, it was. But we still giggled at the point that we were talking about maturity. And so it still makes me giggle when you talk about that because that's just not something that we typically give a crap about when it comes to other things.
We make noises. Anyway.
Yeah, we are the life of the party.
If you do say so yourself.
I know. I'm going to like me being there if you don't. So, number one, we're going to talk about the 6 signs of the HIPAA program maturity and how you know things are changing in your environment. So, number one is staff engagement, not staff infection, but staff engagement.
Well, I put this list together because, we talk about a culture of compliance or, whatever you want to call it, culture of privacy and security, whatever you want to call it, it's what everybody expects. And that's the ultimate thing you want from your program is that it's baked into what you do.
Mm-hmm.
And signs to know if you've gotten there. So I call it signs of program maturity when I did this, but I got to realizing, this should be your goal or your objective in each of these areas. So the staff engagement, obviously, how many times have we said it? It's the people.
Mm-hmm.
We have to have everybody involved. And one of the things that we notice happens every time that we implement new programs and we really get the training going and all of that. We have now started to warn the privacy and security officers when we come in and start building these programs that as soon as this really starts to take root, you will learn so many things that no one told you is going on. Because holy moly, there are so many things that people either didn't realize they should tell you, didn't know who to tell, didn't think it was that important. I mean, there's a long list of things. And once we start doing the training, they become engaged and they start telling you about things. They're alert. They say, hey, should we do this? Should we not do that? I didn't know I should worry about this and that. And by the way, 6 months ago, I clicked on something. Can you look into it?
Yeah.
And it's good. It's good. That's when you know you're making progress.
Yeah. That self-reporting is always hard, but it is very necessary. And we run into that a lot with IT stuff. It's like, yeah, I understand you don't want to take responsibility for it, but we really do need to know whenever you've done something you shouldn't have done.
Well, yeah, we should all freak out together. We should all freak out together matters. Well, plus, when they're this engaged, they start to get that it is about patient care.
Mm-hmm.
The whole reason, if you're a provider, the reason you exist is patient care. That's your objective for patient care somehow along the line. And if you're a business associate, your objective is to help those businesses so that they can concentrate on patient care.
Correct.
Or so they can make the money to pay for staff to provide better patient care or equipment or whatever they need. So everything still, whittles down to it's about patient care. And that
Mm-hmm.
self-policing, when you get self-policing where they're, reminding one another, or, hey, I know you're having a bad day. Can I do that really complicated thing for you?
Yeah.
I know you're in a hurry, or I'm having a really bad day. I'm in a hurry and I've got to do this very important thing. So will you help me do it? Will you do it for me? Will you watch what I'm doing?
Yeah. I think everybody should like overstaff on the Fridays before holidays.
Instead of understaffed.
I know, because that's when all the mistakes happen.
Exactly. And that engagement really is fostered by, you'll start to get it just organically by effective training, where people, instead of, oh yeah, HIPAA says I'm not supposed to do this, this, and this, and then off they go, and I got to use a password and I got to change it. And that's what most people see HIPAA as. But once you start to teach them, what this really means and the things that you should worry about, they start to see things differently. And that's where they start asking questions and saying, I really think that we need to change this because it's creating a security opening, or there's too many chances for human error to have a privacy issue here, which is, that's where we're going. But that really, that it's really fostered and it's going to stick when you get number 2.
Yeah. Well, the other thing I want to say about the all of these really is that even if you're listening and HIPAA doesn't apply to you, this still applies to your privacy and security program, period.
Indeed.
Okay, number 2. You do too.
All right, leadership engagement. And we're not talking about, yeah, I know you got to do it, go do it.
Mm-hmm.
Or, yeah, I'll show up for class.
Yeah, and be on my phone checking email the whole time.
Yeah, not listening. No, what we're talking about is being fully engaged in the program. They're showing up for training sessions. They're asking questions before they take action and listening to what you say. They review the risk management progress in the monthly business meetings. So many people never talk about privacy and security in their monthly business meetings, and it could crush everything you have planned. So why not talk about it? And, make sure that there's resources assigned. They'll ask about vendors' capabilities when they're talking to these vendors. They'll say, well, we really do take privacy and security seriously, and it's not just we say it in a letter after a breach.
Yeah.
It's always said in a letter after a breach, and often after it happens, they do take it seriously.
Yeah. I don't know. It's just always funny when you read it. We take it seriously.
Yeah, but we had this breach. And I'm not saying you're not going to have a breach if you do this, but if you are fully engaged and leadership doesn't disparage the program or avoid the training, and, it's if they're involved in also self-policing each other, because often you're looking at a group of doctors or a group of business owners, accountants, whatever, and if they live that sentiment instead of just saying it in the breach letter, that we do take this seriously, and that we do know that this could impact your life. This could impact your business. Let's look at the AMCA breach. What was the number that we saw today? They're up to $25 million now.
Mm-hmm.
$25 million. And that July, $25 million. 25 million patients from 22 healthcare organizations related just to American Medical Collection Agency, AMCA's breach. Massive breach. So they turned July into the largest breach month ever. It set history in healthcare. That is scary as far as the number of breaches reporting.
Yeah. Probably don't want a trophy for that one.
No. You don't want anybody to know. Keep that one quiet. But
Wow.
if you have leadership engaged and they're talking, the AMCA thing, do you think, I'm just going to venture out here, we don't know. And, we may never know unless Jack does a review, which he should. But if somebody was in the system for 8 months, wandering around, and then when they found it, they fumbled around some more, let's just say.
Mm-hmm.
And, do you think that they were fully engaged?
No.
I'm going to go with that. They're not asking questions. Because if they're asking questions and they're being leaders and they're saying, is this taken care of? And not just, sure, yeah, it's taken care of, but how is this taken care of? Who's in charge? What's the status of it? Do we have things outstanding? That's when you actually care, not just, hey, is that taken care of? Check off my list.
Mm-hmm.
So, I'm not saying, I'm just saying. But anybody that, when leadership is engaged, then the program's going to stick. But if you've got leadership rolling their eyes when they have to go to a training class, or complaining that they have to use a password, or demanding that we don't do this because even though it is a requirement for privacy and security, it's inconvenient for me, so we're not going to do it.
Mm-hmm. Yeah.
That's not leadership.
Just had this conversation a couple of days ago. This company has this big, nice encryption program that they have, and a two-factor authentication platform. Mm-hmm. And so we were having a discussion about it, and I said, well, that's great. You have these tools. How do you use them? Well, we don't really use them anymore because, one of the owners said, throw some explicits in there, get this crap off my devices because I can't get work done. So I'm like, well, that's great. You're paying for the best tools, but then you're not using them.
Yeah, there's that. And that's a lot of what leaders, I threw some money at it. It's one of my favorite lines of Boston Legal. It shows on in the 90s and the early aughts, but it was a really good show. And you should go back and binge it on wherever it's at now. But one of the lines came from William Shatner, live long and prosper he has. But they were talking about how they save money on an energy cost and these kind of things. And he goes, we put the squiggly light bulbs in. That should be the end of that. We put the squiggly light bulbs in. Isn't that enough? No. It's a constant review and process, just like anything else.
Yep.
So if we have leadership fully engaged, that when staff becomes engaged, they will continue to be.
Oh yeah. Yeah. Cause if I'm all about it and then, I see my boss man rolling his eyes or not participating, then I'm like, well, if he's not going to do it, then it's certainly not important to me. It's not important to him. Or
even worse is, I know it's the right thing to do. I now understand, AKA I drank the Help Me with HIPAA Kool-Aid. So, I now understand what the importance is. And now leadership is rolling their eyes and telling me no and making disparaging comments about the things I want to do and on and on and on. And the government can't tell me what to do. And this is so far past that at this point. I mean, come on, we just set a record in July of things that are happening to people, real people. It's not about you. And if I have that feeling, then I am immediately defeated. I feel like I can't win at work. I can't take care of my patients. I can't, so it's a long thing that even if you feel like you're doing the right thing and you have poor leadership, it's going to go down the tubes. So somebody's got to stand up at the leadership level and, say, look, we're not going to do this anymore if we want our people to do the right thing, because we just talked about insiders are the biggest issue. And this is why.
Mm-hmm.
We don't have leadership telling people you need to do this, even if you want to and you believe and you're engaged, but I'm going to disparage it or tell you we don't have time for that. then yeah, insiders continue to be a problem. And it's a leadership problem more than anything else, I think.
Yeah. Or if you're one of those leaders that say, I don't want my people, my staff, to have privacy and security training or HIPAA training because then they'll know what we're not doing.
And we actually have had that.
Right. If that's you, you got problems.
Yeah. We've actually had somebody say they won't let us bring anybody in because they're afraid then that the staff will start turning them in and being whistleblowers. So we're not going to train them. Like they're not getting trained anywhere else.
Mm-hmm. Yeah. I've had people tell me like, we had so-and-so leave and I'm afraid that, she might report us. I'm like, report you for what? Well, because we're not doing this. I'm like, well, that's not her problem. That's your problem. You should really be doing that.
Exactly. So anyway, which takes us to, let's say that the staff starts getting engaged, which also brings along leadership getting engaged, and they're fostering that environment. So now we're engaged and we're worried about it. Then we get to number 3. This is where we really start to see advances in our program.
Yep.
Number 3.
That's when we go into team engagement.
And by team, I mean the compliance team.
Right.
Not the one person that's worried about it.
Yeah, the compliance team of one.
Yeah. Because, your compliance team has to involve somebody that's worried about privacy and somebody that's worried about security. That's part of the law. But also, it is not something one person can do.
Yeah. And a lot of times it is one person that's trying to do it all.
Right.
In the smaller organizations.
But, yeah, if you accept that, I can't do this alone, so I've got to have somebody take over some of this. Whether it's auditing policies and procedures to make sure they're working and we're following them, or we're following them and they're working, I guess would be the matter, right? But, they're actually, because they're part of leadership and the staff, everybody's engaged. So they're not looking at assessments and risk analysis as these huge chores. They're seeing it as a regular part of the work that you do. Just like we talk about, we do risk analysis every day. All we're asking is for you to do them on purpose and write them down.
Oh, yeah. Absolutely. I do it, as I often say, I do a mini risk analysis pretty much anytime I decide to say anything to my wife.
That's right. You got to determine where you stand, what you're going to say. What does her eye look like? Her left eye versus her right eye.
Yeah. Is it twitching?
Yeah. But that's a risk analysis. And I love at the boot camp, when we talk about risk analysis, we talk about this, hey, you do it all the time. And we go around and talk about, here's a scenario that you got to cross this street. And, every person's got a different reason for their decision and how they tolerate risk. Mm-hmm. And that's what we're talking about is you have to evaluate what the risks are and then make your decision on how you're going to deal with it. And that's what it's all about.
Oh, yeah. I mean, we absolutely do this every day, especially if you're driving. I mean, it's the whole process is risk, right? Do you pull out now? Do you change lanes now? Do you turn now? Do you stop now? The whole process is nothing but one risk analysis after another.
Yeah, I saw a friend of mine, her kid has been driving 90 days, had 4 accidents. I was like, why did we not stop at 3 and take the vehicle away? But anyway, that's a whole nother story. Clearly, risk analysis is not something she's paying attention to.
Wow.
The kid isn't anyway. So, but this happens when the team's engaged and, a workforce member knows who's on the team. Leadership knows who's on the team and who's responsible for different parts of stuff. Mm-hmm. Your IT team, whether it's internal or external, they're working with the rest of the compliance team to make sure things are properly documented. They're not complaining about doing it. They're saying, hey, we noticed this thing on the technical side, and we're not following policies and procedures here. Mm-hmm. Or we need to change how we're doing something because of a change that is happening in the industry. And we talked about this on our episode about 7 questions to ask IT. Is that they're staying on top of things. And what were we just talking about today? What, unfortunately, some of these IT folks do.
They don't do nothing. Yeah, they put their tools on the systems and, all this automation's happening. So there's things happening but they kind of ignore the client from there. They're not doing anything else. And we just, before we started recording, I was talking about a new client we just got from another IT company. And the biggest reason why they changed was because they'd been with this company for 3 years and nobody's come in to really sit down with them and say, let's talk about things that's going on and what problems are you seeing and where are you taking your business in the next 12 months? And this lady I was talking to hands me 3 pages of projects that need to be done. And I'm like, this looks like you've never had IT, because, most people don't come in with that kind of stuff. And I'm like, wow. I mean, it's just indicative of somebody who just was not taken care of in a proactive manner. They just put this stuff on there and it's like, call me when you need me.
Yeah. That's when you're buying monitoring and help desk. So you need to understand that your IT team is fully engaged when they're worried about more than monitoring and help desk. Yeah, that they're coming in and saying, look, we've got to get these patches installed, or I just realized that 2FA isn't enabled on this app and now it has it. We need to, look at our risk analysis.
Yeah. I mean, it really is just as simple as saying, do you feel like they're reactive or proactive? If you can't say they're being proactive at any level at all, then you're not getting serviced in our industry, not these days. Yeah. So, I could go on and on, but anyway.
Yeah. Preach it, brother. Preach it.
It's just, even though I got the business because of this, it still hurts my industry that people do business this way.
I agree. It is. It is very much so. And you want to be in the position where your compliance team, when you hear about what happened at somebody else, there's a big breach that hits the news, the AMCA thing. You hear us talk about it. You come into work and you say, has anybody looked at what happened there to make sure that we would be prepared? Do we need to be asking any of our vendors if they're using them? Because guess what? Quest wasn't directly hiring them. Somebody else was hiring them, So
yeah, definitely need to ask those questions. And we cover that on this show is, how did it happen? What happened? Why did it happen? We dig into all that so that you have the ability to have those conversations with your team.
Exactly. So your team would then proactively say, hey, in group email, group chat, whatever it is you use, or, face-to-face meeting, and you discuss so that you can say, do we have this handled? Woo, really glad we already did X, Y, and Z.
Mm-hmm.
So there you go.
All right, so that's number 3, and that brings us to number 4, which is one of the things we talked about a few weeks ago when we talked about what things can you do that'll bring down your total cost of a breach or your per record cost of a breach. And this is one of them, which is having an incident response team. Of course, the first one was, having kind of an incident response plan, and then it was also, putting the plan into action.
Well, if you have a team,
you're doing all that.
By nature, get a plan.
Right. So, you want to know how to drive down those costs. Should something happen, this is definitely one up.
Yeah. So, you're not just, we're going to go to paper. That's my favorite plan. But you've evaluated different things. Everybody knows what to do in a crisis. You know how to access resources in a crisis. You actually do real tabletop exercises where somebody's throwing a wrench in it from time to time and telling the story, so you don't really know what's going to happen, and everybody's got to talk about what they were doing and how they would handle it. Mm-hmm. Everybody in leadership and the compliance team and the staff knows you have an incident response team. They know who to call. Who you gonna call?
Ghostbuster.
Anyway, giant mushroom. Mushroom. Seriously? Marshmallow.
That was back in your college days when you would holler that.
See? Wow. Well, Ghostbusters was back in my college days. Maybe that's why it's all mixed together.
That and Smurfs, who knows?
No, Smurfs. Well, anyway.
They had the mushrooms.
I know, but I'm too old for Smurfs. I have a Smurf story. It's not for the show. It involves, never mind. So it's important to know that another study that came out, I haven't had time to read it all, that says that they found that your churn, that they call it, where you lose customers, that the sooner you notify in a transparent manner, the less churn you have. And obviously, the longer it is and how you try to hide it, the more you lose clients.
Yeah, but that's a thin line as well, because we do know the rush to notify is not something you want to do.
Well, yeah, you don't want to just scream, we've had a breach, we've had a breach. And then,
I told everybody within 15 minutes of knowing.
That's right. It only involves 400 people. 400,000? Sorry, my bad.
Yeah, because the quicker you notify, the more often you have to change what you tell people.
So you got to get it in that right balance. So waiting for 60 days when you're going to have to notify, that's not recommended. Now, if you still haven't figured out your scenario, that's different. But once you need to just do it. Don't say, well, we've got a little time, let's put it off as long as we can. So anyway, your incident response team's going to understand all those nuances because they've gone through them. They've talked about them. They've evaluated what would they do if we had, we know there's some severe storms coming and tornado outbreaks are likely and we get tornadoes here, or in the Carolinas where we get hurricanes and tornadoes inside hurricanes and flooding and storm surge. You're going to worry about all those things because you have an incident response team that has integrated into the business continuity and the disaster recovery team. That's all tied together. Boom.
And then you got it.
So now, number 5.
Oh, man. Like we've never talked about this one. Number 5, which is, what we do here. Training.
It's baked in.
Yes.
Yeah. It's not once a year.
Oh gosh.
It's something that you're actively discussing, and your maturity will show when you have a high awareness every day. You have a meeting and somebody says, yeah, we're bringing in this new device. And somebody else says, hey, how are we going to get trained? Who's going to evaluate the security? That is actually a conversation. And, so-and-so's leaving. They're the only ones that understand how to set up the security of blah, 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 blah. Let's worry about that. Who do we need to get trained? So it's that kind of stuff, as well as our favorite training is phishing test. If you're not doing phishing test, you're just waiting to get a data breach. I'm sorry.
Yeah. Well, it's one of the best ways to test the training in most cases, because we know that the 90-something% of these problems and these malicious things come through email. So if you're not testing the users of email within the email platform, you're missing out. That's exactly where you need to know what's going on.
Oh, yeah. And then it becomes a thing where people take pride in those statistics staying low, that they're not falling for it. And you tell them about those statistics. And sometimes you even have to ridicule the frequent clickers. I don't know. Yeah. But you also do. Go ahead.
As I say, we definitely want to talk about the people that are doing it right. You want to give a lot of public praise to them and all of that, because what you focus on is what you get. And so when you focus on that positive, you'll get more of that positive. So don't turn this in. It's always the carrot or the stick thing, right?
Yeah.
But you'll definitely get more with a carrot.
Yeah, it's look how well we're doing. Look at how well we did, and promote that. That's as much. You run the test. That's training, but then we don't hit everybody when we run the test. But then when you report how everybody did and how your statistics are, and you show trends and those kind of things, then that is also training.
Yep,
because it's rewarding those who did it correctly and reminding those that didn't how they're part of the problem, and the ones that never saw it, hey, boy, I'm probably next.
Yeah, I have to say I have one of my upper level engineers controls our platform for that. So he tests us, and he knows we're we're trying to hire right now. So I got an email the other day from one of the job posting places that said something about my account. And I was like, hey, he's trying to be slick. He's sending me something from one of the job posting platforms that he knows I'm on every day right now because we're trying to hire.
Yeah.
And I was like, no, you're not going to get me.
I know. We now get, Carla has to go in and confess that she was on vacation, out of town, family stuff going on, and she fell for one. And one of ours, and she's she's like naming it and claiming it, raising her hand. Yeah, I did it. But thankfully, it made me more aware of don't do email when you're not paying attention because of these things.
Mm-hmm. Yeah.
But then also, as we pointed out in previous episode recently, is some of the training things you can do. And we're not talking about sitting everybody down. I can't, when we talk about training, I can't afford that. I can't put everybody in a room. That's not what it takes.
Nope.
And in fact, that's not really that helpful if that's the only training you're doing.
Yeah. I mean, you're doing training around everything else in your business. I mean, surely you're not hiring people and put them in a desk and going, here, figure it out.
So that's why we use National Cybersecurity Awareness Month that we just talked about. You've got plenty of tools there. It's distributed freely for you to use. And then in January, there's National Privacy Day or International Privacy Day. And it has events and some things around it as well. So we're talking about, a point where training isn't once a year thing that people dread, hate, blow off, blah, 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 because it's the same stuff over and over. This is, hey, I went to a conference and I sat in on a session about HIPAA. Here's some things I learned, and here's the documentation for my training.
Mm-hmm.
I tell people all the time, and I'm speaking at a conference, you will be, going back and documenting you got HIPAA training here, right? Because that's what we're talking about right now. And you'll see everybody start scribbling. I should go do that.
Yeah. Or sometimes people go, oh, we can count this? I'm like, yeah.
It's training, and the fact that you're getting it only helps your business and therefore helps your patients and so on and so forth.
Yeah.
So account for your training. And, when people walk through your office, you expect them, when I go through an office and I'm seeing a tattered thing on the wall about don't remember, don't tell anybody anything that you wouldn't want shared, and it's kind of dog-eared and hanging on the wall, or here's our notice of privacy practices from 2003. At that point, I'm going to not feel comfortable with their privacy and security program.
Yeah. And if you're listening to this show, then there you go. Training right there. Every week you should be documenting.
Yes, I concur. And you know what? You can do that.
Yep. Which brings us to number 6.
Documentation.
Documentation.
This is the best part, is that all that other stuff's going on. You're documenting it as you go, so that if somebody says, that's one of the things in boot camp that we show them the OCR request, like a real OCR request letter after a data breach when they're going to investigate, and the things that it asks for and says to give it in 10 days. And we actually have multiple ones. We never make it past the first one. Have you noticed that?
Mm-hmm.
Because everybody starts to panic over the documentation they do not have. So the good news is, when you have a mature program, you will not panic over it. You will only panic on whether or not you documented those last few things that you did. And, your staff will supply training, just like I talked about. They're going to give you documentation. They'll bring it to you. Or maybe you use the Help Me with HIPAA podcast app and email it out and encourage others to do it, because you can send your own HIPAA documentation training documentation from the app. Whew. I don't know. You might as well bring us home on this one, because I got nothing. I clearly can't talk.
All right. So there's the 6 ways if you are being mature or not in your HIPAA program or your privacy and security program, because you can apply either way. So whether HIPAA applies to you or not, because chances are something applies to you that has the same type of format, whether it's PCI, HIPAA, FINRA, pick any acronym you want to pick. They all, FERPA. They all have a framework that's going to ask you, are you doing a risk analysis? Are you doing training? Do you have a way to respond to incidents? Are you documenting things? Because you're documenting things for a reason. It's not just to say, hey, yeah, we did it. It's documenting things to show proof that you're doing things, and so that you can also go back and know why certain decisions were made. Because, you ask me tomorrow why I did something today, I'm like, I don't know.
That's already a problem.
I know. So,
but point out one thing, very, very important. None of these things involve technical things.
No, they absolutely don't. And they're all not costly either. I mean, how much does it cost to get staff engagement, to get leadership engagement, to get team engagement, to develop an incident response team? Even training can be free.
Well, training, it builds all those other things.
Right. And then your documentation. So everything we're talking about is stuff that you have at your fingertips. The training part, there's paid training, there's free training, this podcast. So you have all this there. So there's nothing that you need. But this goes to a point I actually made on another podcast, which is when people come to me, and maybe they do you that way too, Donna, and they're like, what's that one thing that we need to do that's going to make the biggest difference, or whatever. And they're looking for that silver bullet. And I say, look, it's training. It's staff training. That's the biggest thing that you can do that doesn't have a lot of cost to it, but has a huge impact. And I always get the same response, which is, oh man, I was really hoping.
It's training that's not, let me tell you what the law says. Let me tell you, change passwords. It's training that engages the staff. You got to make sure you're doing that.
Yeah.
So not just, let me throw some training at it.
Yeah. And we actually have an entire session about this at the HIPAA boot camp, where we talk about training, how to do it, how to get the engagement. You would think it, it's kind of makes sense, but oftentimes, we really have to take people down the path of, these are some ways you can do training. And sometimes people have said to us, wow, I didn't know you could do it that way, and it count. And I'm like, oh, yeah.
Right.
Yeah, you can do it this way.
It says training and security awareness training. It doesn't say, you got to have a lawyer do it, which I don't know your experience, but lawyers training sometimes not very helpful.
Yeah. Well, it's also a problem.
Also, nerd training not always helpful either.
Yeah. Well, the problem a lot of times too is, you're telling somebody you need to provide privacy and security training, and they're going, but I don't even know what to do. How am I supposed to provide training? And that's why they, they end up going out and buying other people or other tools to do it. But that's really the main focus of this podcast, is making sure we're providing that level of training for you, so that at the very least you have some education around what you should be doing, not doing, or what you should know.
Indeed.
Anyway, anything else from you, Donna? Or are you shot for the day?
I need a nap.
Because we have definitely defined that your tongue is flapping and your brain is napping.
No, I think it's the other way around.
Is that what it is?
The brain's going way, way fast. And so then the tongue is just making stuff up.
All right.
I can't keep up. I'll just make stuff up.
Oh, boy. All right, so we'll cut it right there. So remember to follow us and share us out on your favorite social media, folks. Rate us on our podcasting app. Don't forget the HIPAAbootcamp.com. Check it out. We do have a few more seats available. This will be the last one of the year. Help us spread the word. Get some people in there. If you show up, we will be there.
We have built it. Now you come.
I know. So for Donna and myself, remember, the HIPAA is not about compliance. It's about patient care.
You've been listening to the Help Me with HIPAA podcast, hosted by Donna Grindle and David Sims. The show created to help you with HIPAA. For more information or to ask us a question, visit our website at helpmewithhipaa.com. Neither Donna Grindle or David Sims are attorneys, and they do not offer binding legal advice concerning regulatory compliance. The information in this podcast should not be relied upon or construed as legal advice in any way. Consult your attorney for legal advice concerning compliance with HIPAA regulations.